Hi there. Welcome to IEP Development for Speech Language Pathologists Part 2. In this section, we'll talk about special consideration, goals, and services. My name is Angie Neal, and I'm the Speech Language Pathology Consultant and Policy Advisor for Speech Language Services and Early Literacy at the Office of Special Education Services at the South Carolina Department of Education. In being consistent with Part 1, this is just a reminder that each section of the IEP should connect with the other sections of the IEP. In other words, if something is mentioned in, say, for example, the IEP goals, it should be connected to other parts of the document. Let's start by looking at special considerations. Here's a screenshot from EdPlan of special considerations. Special consideration asks, are there communication needs? Well, we would click yes because this is why we are providing supports and services as a speech language pathologist. This provides that thread of consistency to the services page where we outline the speech language services. Now we also need to look at what is the area of communication need. This section provides that thread of consistency to what is addressed then in the present levels. Are we addressing speech sound disorder? Are we addressing a language disorder or a fluency or voice disorder? Then we also have describe the communication needs and how they will be addressed. This is where we connect to the present levels, the goals, and the services. If the IEP team determines that the child has communication needs, then the team will need to address these in the IEP. So think of special considerations as sort of the outline or what you're going to find or the preview of what's in that IEP. So special considerations is really just a snapshot of what you're going to see in the rest of the document. To get a little bit more in depth with describing the communication needs and how they will be addressed, I want you to keep in mind, again, this is a snapshot to use that analogy. And this section is going to need to include information such as the things that are related to the present levels or impact statement. So for example, the student is eligible or continues to be eligible to receive services as a student with a speech language impairment in the area of, and that's where you would say speech sound disorder, language, voice, fluency, because it is that disability is having an adverse educational impact. As far as how it will be addressed, that's where you want to talk about the student will receive specially designed instruction, either in the small group setting or one-on-one. Now, if the student is receiving telepractice services or services virtually, this needs to be noted in this part of the special considerations. Now let's talk about goals. Here's a screenshot from EdPlan where we're looking at adding goals. In this screenshot, you see that there's a section where you select the goal area. Now, one of the goal areas is communication. So the question is often asked, do I select communication or do I select speech language? Well, communication is the most appropriate choice if the student qualified under developmental delay, and one of the qualifying areas for developmental delay was communication. Otherwise, select speech language. Speech language would be the most appropriate if the student qualified as a student with a speech language impairment and the student is receiving direct and or indirect services, or the student is receiving speech as a related service, either directly or indirectly. Now let's talk about writing IEP goals. Should they be SLP, speech language pathology specific, or could they be collaborative goals? While we may not often think about it, there are several advantages of receiving services within the school setting. One of which is being the fact that there's a variety of professionals and experts, and they're all in this building at the same time. And we're all in the building at the same time as the student. And we're all in the same building with the student, working with them on the skills that enables them to be successful in that environment, in that educational environment. So this is really sort of helping to illustrate how important a collaborative approach is. And the expert supports this. The research and expertise supports that collaboration. This is what enables professionals with diverse expertise, diverse backgrounds, to generate innovative solutions to mutually defined problems, meaning we are all there in that building with the same goal and the same purpose, with the same problem to remediate, which is to get and support the student on getting on grade level. So when we appreciate this, we can then enrich that academic assistance for that student at every educational level, and that maximizes the effectiveness of what all of us are doing. The research further supports the benefits of collaboration by saying collaborative services benefit the student by targeting skills that are reinforced multiple times a day, throughout the day, in multiple locations. In other words, this provides lots of opportunities to both acquire and practice these new skills throughout the day, as opposed to just working in silos and thinking about instruction in single points of the day. And so we're more effective when we're scattering these supports and services throughout the day. Collaboration has also been deemed as the best practice in special education. But conversely, the lack of collaboration by professionals has been shown to negatively impact the extent and quality of services that are provided to students with special needs. And especially in terms of language development, it's important to keep in mind collaboration and language, because general education teachers and special education teachers, they have some of the greatest opportunities to accelerate language comprehension development, because that's where students are exposed to the most language, which is during content area instruction. This is especially important from the standpoint of collaboration within preschool. And preschool teachers have significantly improved their instruction in early literacy skills, such as vocabulary, phonological awareness, and complex language, especially thinking about syntax, when those things are modeled by the SLP during co-teaching. And what does IDEA have to say about collaboration? Well, if you think about it, IDEA consistently refers to a team approach in order to ensure access of the child to the general education curriculum, again, to meet those educational standards that apply to all children. So IDEA's frequent reference to the term team implies a collective responsibility with no one single service or no individual being solely responsible for the progress and development of any particular skill. And that is also why IDEA affords this beautiful continuum of service delivery options for most restrictive to least restrictive environments, by appreciating that intervention is a shared event across environments. So one takeaway I hope you get from this is that we should be collaborating within the continuum of services. Specifically, could or should we be writing collaborative IEP goals? Well, although IDEA requires a statement of the special education related services that students require to work towards achieving their goals, IDEA does not require specifically that each service provider write a discipline-specific goals. In other words, IEP goals are individualized to the student. IEP goals do not belong to a specific discipline. This also supports what was referred to as working at the top of your license, and that really just means utilizing the full extent of the education, training, and experience that you've gained, and not spending a lot of time doing things that could be effectively done by someone else who has a different set of skills. In other words, maximizing our time so that we can make sure that we're supporting students who truly need us, and then for those students who could also benefit by the same instruction with somebody with a different set of skills, that we let them. Here are a few examples, just looking at or opening your mind to collaborative IEP goals. Let's say that there's a collaborative IEP goal targeting vocabulary. Well, in this situation, the special education teacher might target and provide data, and they're really talking about the specific breadth of vocabulary, meaning that we're working to increase Tier 1 and Tier 2 vocabulary. And they may target this through answering oral comprehension questions, and this is going to be or should be related to grade-appropriate curricular vocabulary. So for example, in this sentence, what does the word famished mean? Also, using that same target of vocabulary, what might the SLP do? Well, the SLP might target and provide data specific to the depth of vocabulary, meaning that we're helping the student get that deeper understanding of vocabulary. And we might be working on things like category, function, location, visual characteristics, word relationships, and connections to background knowledge. We can also think about this in terms of goals related to phonological awareness. Both the special education teacher and the speech language pathologist can provide data and target phonological awareness skills, all of those that are identified as weaknesses, especially relative to the student's acquisition of the ELA standards. What about language as it relates to complex sentences? Well, this is a huge barrier to comprehension. So the special education teacher might target and provide data on sentence complexity relative to oral reading fluency. Reading fluently those sentences that are syntactically complex, while the speech language pathologist is targeting and providing data relative to specifically identified errors in syntax or types of complex sentences that the student has not yet mastered. What about phonics? Well, both the speech language pathologist and the special educator can target and provide data based on writing samples. However, the special education teacher is looking at those phonic patterns that have not been mastered relative to what's been grade level appropriate in terms of the ELA standards that they should have mastered. But the speech language pathologist is really looking more at it in terms of the phonology and the morphology related to those errors that are identified or have been identified in the student's morphology, or even those weaknesses in speech sound production. So for example, if the student is having difficulty spelling words with R and producing words with R, or producing plural S or past tense ED, as well as what are those patterns for how those those morphemes can be added to the end of words. What is that specific pattern? What about narrative skills? Again, both the special education teacher and the speech language pathologist can target and provide data relative to what are the age-appropriate features of narrative development, especially in line with what the ELA standards expect to have been taught and mastered. And depending on the age of the student, the special educator may target and provide data about the use and inclusion of the features of narrative writing, while the speech language pathologist may again provide more of that depth related to the use of sequencing terms or those transitional words. In terms of pragmatics, the special education teacher might target and provide data relative to perspective taking specific to content curriculum. But the speech language pathologist might be targeting and provided data specific to that stage of theory of mind. What stage is that student in, and where is that student moving to in terms of the stage of theory of mind? Also in terms of central coherence and making sense, a general whole out of a multitude of details. Here's a screenshot that looks at the components of IEP goals. And let's talk about compliant IEP goals for a while. So again, first we need that thread of consistency. There should be a direct relationship between the measurable annual goal, the baseline data, and what the needs are as having been identified in the PLAF. So measurable annual goals are descriptions of what the student can reasonably be expected to accomplish within that 12-month period with the provision of special education and/or related services if applicable. The IEP team must consider identifying goals that will allow them to be involved in and make progress in the general curriculum, as well as being aligned with grade level standards. For more information on that, you can refer to OSIP's Dear Colleague letter from November of 2015. Now, this does not mean that goals must include grade level standards, but rather the goals should assist a student in reaching grade level standards. So that's why it's important to know the scope and sequence, that vertical alignment for those specific skills. in order to map out the progression of IEP goals in order to get the student to grade level. Annual goals must also be based on skills. So IEP goals must be skill-based, and they must address the required skills, specific skills, that the student needs to master the content of the curriculum, as opposed to writing a goal that focuses on mastery of the curriculum. In other words, we're really working towards aligning with those standards. The content that is within that curriculum is the ELA standards specifically. And the skill deficits within the PLAFT and that are identified as the priority educational need, those have to be the skill deficits that are also identified in the annual goal, and they should align with the grade level content standards. Again, what is that progression? Moving along those vertical alignment of the content standards. Now, for those students who are functioning well below that, those who are taking alternate assessments, they're aligned with alternate achievement standards. And so that includes a description of benchmarks or short-term objectives. Those must be included for each annual goal. And there must be at least a minimum of 2 of them. And well-written measurable annual goals should be clear enough that someone who doesn't know the student could use them to develop appropriate instructional plans and assess the student's progress. In other words, if a new SLP walks in tomorrow, they should be able to pick up that IEP goal, begin creating instructional plans, and even monitor that student. Just pick right back up with wherever you left off with progress monitoring for the progress reports and keep on going. And IEP goals should be written in a way that the target behavior or skill is something that the student will do as opposed to not do. So for example, we want to avoid verbs such as they won't do this or they will refrain from that. Now, the number of goals addressed in the IEP, that really depends on the student needs. You want to take into account those prerequisite skills, that continuum of development. What are the student's immediate needs? And what is the general applicability? Those are all factors that you want to consider when you're writing or planning or establishing a goal. In EdPlan, you will see that IEP goals are broken down into several different ways. So what you'll see is the condition. The condition specifies the manner in which progress towards the goal is measured. So conditions are dependent on the behavior being measured and involve the application of that skill or knowledge. So for example, the behavior could be when given a structured task with various prompts, or when given a list of Tier 3 third grade vocabulary words, or when given a pragmatic scenario or situation targeting whatever the skill is. The targeted skill or behavior, that is where we need to clearly identify the performance or skill that is being monitored. And usually this reflects an action, or it can be directly observed, and it should be measurable. So examples would be the student will correctly produce the phonemes R, vowel controlled R, AR, those kind of things. Or the student will generate targeted phonological awareness responses for blending, for segmenting. Or the student will summarize or state in their own words passages of a paragraph, one paragraph in length. Now, keep in mind that specific details regarding exactly what the student will master within 364 days, that is the expectation, because IEP goals must be ambitious, but also achievable. In terms of criteria, the criteria should include the level of proficiency and how it's going to be measured. So level of proficiency identifies how much, how often, or to what standard the skill must occur in order to demonstrate that the goal has been reached, as well as the amount of growth that is expected to be made by the end of the annual goal period. So it must allow for a clear yes or no determination. So for example, yes or no, did they go from X to Y accuracy? Yes or no, did the student go from blank to 10 words out of blank to 10 words? Yes or no, did the student go from blank to blank number of stuttered words per minute? in terms of measurement. This describes how it will be measured, including what tool or methodology we're going to use to measure it. The measurement device used in the goal must be the same measurement device used to establish the baseline in the findings. So, for example, your measurement tool could be criterion reference testing. Your measurement tool could be curriculum-based assessment. I will advise you not to include the term informal assessment because there is no such thing as an informal assessment. You're either doing a language sample or you're doing a criterion reference assessment, but these are all assessments. They're not formal or informal. They are all specific types of assessment. Now, what about adding goals for a different area of speech language impairment? So let's say the student is currently being served in speech sound production, but we want to add a goal for language. Well, it is not necessary to open a reevaluation to establish eligibility if another area of speech language is suspected as an area of need. So again, if the student was initially classified as speech language impaired based on language, but now we're concerned about fluency, we don't have to reopen an evaluation. The SLP should, however, conduct the appropriate assessments to collect appropriate data that supports adding those goals based on specific data that is gathered. And all of this information should be documented within the IEP as well as the prior written notice. Now, if the SLP is submitting for Medicaid reimbursement, the SLP still must adhere to Medicaid requirement related to the documentation that supports that additional diagnosis and any changes to the treatment plan. Now, what about adding other special education goals that are not related to speech language impairment, but the student is currently only speech only, but we're considering adding other special education goals such as reading? Well, if a student with a disability classification only in the area of speech language impairment begins to demonstrate difficulties not previously identified in the initial evaluation, well, before goals can be added to that IEP for any area of perceived need, with the exception of transition when appropriate, the IEP team needs to meet and gather data. And this data does not have to be part of a reevaluation review, but it may result in a reevaluation review depending on the decision made by the team and based on the data. Let me explain a bit more. The data that needs to be collected by the IEP team should include and outline what are those specific areas of need? Has the student received interventions? What is the evidence base for the Tier 1 instruction and the Tier 2 intervention? Remember, that's a rule-out factor for IDEA. We also need to consider progress monitoring any data that demonstrates the student's response to intervention. Now, intervention may not delay or deny access to a full and comprehensive evaluation. But if the student is participating in tiered intervention, we need to look specifically at the rate of improvement, not progress towards whatever the goal is of the intervention, but the rate of improvement, because the rate has to be enough in order to close the gap. We also need to consider, as the team, what adjustments maybe could be made to the intervention program to improve outcomes. So maybe move from Tier 2 to Tier 3 by increasing the intensity of the intervention. Also, making sure that the intervention has specifically identified exactly what those weaknesses are so that we can ensure exactly what the student is or isn't responding to in the intervention. And again, all of this data should be reviewed by the team for the sole purpose of considering whether or not there is reason to suspect another area of disability. And if the data says, yes, there's reason to suspect a disability in an area other than speech language impairment, a reevaluation must be considered. And while the reevaluation process is taking place, the student certainly may continue to take part in tiered intervention programs. And this actually means that the intervention process can take place concurrently with the reevaluation. And actually, that's going to provide a tremendous amount of excellent data and data points that can be used in combination with the other assessment batteries that perhaps the school psychologist is going to be administering. So again, this speaks specifically to delay or deny. You can have the intervention taking place concurrently with the reevaluation. Now let's talk about progress reporting. This is a screenshot from EdPlan of what progress reporting looks like. Now, to answer the question of how often must progress reports be sent home? Well, determining the frequency of progress reports is a decision made by the IEP team. And what is it based on? The needs of a student. There is no rule of thumb, quote unquote, that applies to all students for how frequent progress reports must be sent home. This was a change in IDEA, and I show you the specific reference below in the red box. When periodic reports on progress the child's making towards meeting the annual goals, such as through the use of quarterly or other periodic reports concurrent with the issuance of report cards, will be provided. So report cards are issued quarterly. So you can issue progress reports for the interim and or quarterly, but it's specifically referring to quarterly here. But when those are issued is a decision made by the IEP team. Now let's talk about services. This is a screenshot of the services page in EdPlan. One of the things that we appreciate most about services in the least restrictive environment is that removal of children with disabilities outside, pulling them outside of the regular education environment, that occurs only if the nature of the disability or the severity of the disability is such that education in regular classes with supplementary aids and services cannot be achieved satisfactorily. That is the exact quote from IDEA. So the question to the team needs to be, does the nature of the disability require the SLP to provide services? Also, does the severity of the disability require the SLP to provide services? And then teasing that apart in terms of, are direct services by the SLP required and necessary, or perhaps indirect services? Because if those can be provided, those supports can be provided with the use of supplementary aids and services, then that student is no longer considered a student who is in need of specially designed instruction. So let's think through some case scenarios, some examples of students who may no longer need specially designed instruction by an SLP. It could be a student who's making good grades and they're performing well on their assessments when they're utilizing their strategies or accommodations. So for example, maybe they're using graphic organizers, or the teacher's pre-teaching vocabulary, or they're using audiobooks. They may no longer require the specially designed instruction or direct specially designed instruction by an SLP. It could also be a student who has nearly mastered their speech sound production at the conversational level, and now they're only working on self-monitoring. And self-monitoring can be supported with models and reminders in the classroom. In other words, that does not require the specially designed instruction or special skills and expertise of an SLP. Same thing with a student who might have a fluency disorder and they've established their strategies that enhance their fluency, and they're now working on self-monitoring or even generalizing those strategies. Well, again, that does not require direct, specially designed instruction by an SLP. Another example would be a student who has pragmatic language difficulties, but they're also receiving adequate special education supports to address those social specific needs. And keep in mind that services are determined by the IEP team. Services are determined by the IEP team. So IDEA very specifically indicates that the treatment approach is determined by the IEP team based on the needs of the student. So service provision should not be based on the availability of speech language pathology personnel. Services should not be based on the speech language pathologist's schedule and availability. They should not be based specifically on whether or not the speech language pathologist is in person or is the speech language pathologist is doing telepractice. Services should not be based on whether or not those services are able to be reimbursed. And those services should not be based on what the student has traditionally received, what they traditionally always provided, 2 times 30 per week. In other words, if there were more personnel or the student switched from telepractice to in-person, you have to really consider, would the same services be recommended based on the student's needs? So for example, if the SLP was virtual, and so the team moves the student to one-on-one for virtual telepractice services, if the student or an SLP now becomes available in the building, what dictates that student's services? What need? Is the need based on the fact that now there's an SLP in the building, so now the student can receive group services? So the needs of the student are what drives the services. And keep in mind that services really and truly should fluctuate based on the student's improvement, but of course specific to how those services are written in the IEP. What I mean by that is, as the student's skills improve, their services should decrease. And doing so is what helps support that the student is in the least restrictive environment. And it also provides great data as to whether or not the skills are maintained as the supports fade, because the skills have improved. Also, services should be based on the minimum a student needs in order to demonstrate progress. So there's not a magic number for how much time should be spent addressing any specific skill. There's no research that supports that whatsoever. But the goal is instead to remediate the difficulties as efficiently as possible in order to best support least restrictive environment and the provision of a free and appropriate education. So consider what the continuum of service delivery may look like. This continuum may start with direct pullout from the classroom, and this might be where we dig deep on instruction into very specific skills. Then the instruction might move, and it might move to more instruction and support in the classroom. Then instruction could move to being indirect support or supplementary services if the student has another area of disability. And then eventually the continuum leads to considering whether or not the student still meets ongoing eligibility. And all of this moves from most dependent to least dependent, or most restrictive to least restrictive, with consideration for, again, generalizing skills into the educational environment, reducing the amount of direct services, again, as those skill improves. What is the location of the service? Is it the therapy room, the classroom, or even somewhere else? Also, increasing consultation or indirect services with the teacher and or the parents. And that there's a variety of service models for how this can be accomplished. There is no hard and fast rule for various service models. It all depends on the need of the student. So for example, you may have speech sound production kids who they need just that 5-minute blast therapy. You come in, you work on the skill, you drill it, you give generalization supports, and then you move on. So that could be 5 minutes a day, every day, 4 or 5 days a week. And that may be the way to most efficiently support that student in quickly and efficiently remediating that disability. On the other hand, you could have students who serve in the area of language. And say, for example, a 4th or 5th grader, and you're working on language, again, specific to the content of the ELA standards, using that curriculum, you're really and truly going to need more than just 30 minutes at one time to in order to dig deep on all of those different skills. So that could be a student that you serve through the 3-1 model. And the 3-1 model, where you see the student either for 45 or 50 minutes, however many days per week, depending on the student needs. And then you have that 1 week, and that 1 week is specifically for the provision of the indirect service of working with that classroom teacher and or special education teacher to, again, work on that collaborative piece. How are they progressing with you? What are the new concerns that have popped up? What is the content that we're seeing? Time to gather the students' curricular assessments to see how their skills that you're teaching are transitioning specifically into the student's educational success. So again, think about these different approaches that we could be using in order to effectively and efficiently remediate a speech-language disorder. And again, keep in mind, these services are not determined by any one person. They're determined by the team based on the needs of the student, with consideration for a least restrictive environment, and just the fact that there are other models of service delivery that are effective and efficient, or more effective and efficient than just the traditional 2 times 30. And the benefit of having a variety of service approaches in your back pocket. So all of these different examples, the variety, the benefit of this variety includes opportunities to collaborate. Again, as I've mentioned, how important that collaboration piece is, as well as helping the student focus on independent monitoring and stabilization of their skills. Also affords those opportunities to make up those missed sessions and increased ability to integrate all of the IEP goals within the classroom curriculum and supporting that across all of the different educational environments and school settings. And here's an easy decision tree that you could use as a guide for whether or not you're providing direct, indirect, or supplementary services. So for example, the first question is going to be, at any time, will you be providing direct contact or having direct contact with the student? If you're not having any direct contact with the student whatsoever, so for example, the contact is going to be more with your staff or parents or other IEP team members, that is a supplementary aid or service. If you are providing some contact with the student, so for example, you're going to be progress monitoring how well the student is doing. That's some contact. That would be more of an indirect service. So not only are you providing having some contact with the student, but you're also still working with all of the other people who work with the student. So the SPED teacher, the general education teacher, that's indirect. And if yes, for sure, you're working directly with the student, you're interacting directly with the student, you're providing instruction directly to the student, of course, that's direct service. On this slide, you're going to see an example of the variety of direct services. As I mentioned, you could have 45 minutes once a week targeting language using curricular content. My favorite has always been social studies. You could also do 30 minutes of direct instruction once a week for 3 out of 4 weeks per month, where you're remediating and providing instruction specific to that identified area of need. And then that 4th week is your indirect service. That's where you're directly working with the general ed teacher or the special education teacher and giving them ways to support and reinforce those skills, or again, looking at and reviewing the student's progress, including their progress towards curricular content. Or 30 minutes of direct service twice a week, focus on identified needs. So perhaps maybe you're doing narrative-based instruction. Or another direct service is co-teaching or push-in services where you're specifically targeting skills that have been identified. And here's some examples of indirect. So again, indirect services may be provided directly to the child. So for example, you're just maybe working with them to progress monitor on goals, but you're also providing service on behalf of the child. And that may involve teaching them or consulting with or collaborating and or directly supervising other educational personnel. So here's some examples of that. So it could mean supporting a special ed goal by providing consultative support to that special education teacher and the regular education teacher. And that might be helping them to identify those tier 1, 2, or 3 vocabulary words and what that explicit instruction in those vocabulary words maybe what that might need to look like. Indirect could also include creating or sharing materials or home programs to support development, or collaborating with the regular education teacher to analyze the language demands of the curriculum. So specifically, what about this curricular assessment might be hard for this student? Is it a specific type of question that keeps tripping the student up? And having us analyze the language demands of those questions on there to see what the impact might be on the student based on their disability, and then create strategies to work around that to improve outcomes. And finally, supplementary services. And the primary differences between indirect service and supplementary services, aids and supports, includes the fact that supplementary aid supports and services, those are not tied to an IEP goal. I'll say that again. Supplementary aids and services and supports do not require an IEP goal. Indirect services do require an IEP goal. So in a supplementary service, your provider, the SLP, is only working with staff and parents. They're not doing any direct contact with the student. Also, supplementary aid services and supports, those are provided across all educational settings in order to enable the children with disabilities to be educated with non-disabled children to the maximum extent possible. Now let's talk about speech-language services, which speech and language is unique in that it can be a special education service or it can be a related service. So let's talk about the difference between the two in order to know which one is the appropriate one to select. Speech-language services are considered a special education service only when the student meets eligibility criteria as a student with a speech-language impairment. Now, speech-language impairment can be a primary classification or a secondary classification if the student has another category of disability. The determination for whether or not speech-language impairment is primary or secondary is a determination made by the team based on the data that reflects which area of disability the team feels is having the greatest impact on the student. A question that often comes up is whether the speech-language pathologist is just the speech-language pathologist and or also the special education teacher or provider. If the student is speech-language impaired only, the SLP personnel should select both speech-language pathologist as well as special education teacher provider. The reason for this is twofold. First, it's because the speech-language pathology is providing the special education service. The special education service that just so happens to be in the area of speech and language. The second reason for this is due to compliance with IDEA. IDEA, as you see cited here, specifically requires the members of the IEP team to include not less than one special education teacher of the child, or where appropriate, not less than one special education provider, which in this case, if the student is speech-language impaired only, that special education provider is the speech-language pathology personnel. Speech-language pathology service can also be a related service. The only time that a speech-language pathology service is considered a related service is if the student does not meet eligibility criteria for speech-language impairment. But the student does have, as you see in number 2, does meet eligibility criteria in another one of the categories of disability. And number 3, the team feels that service and support by speech-language pathology personnel is necessary in order for the student to, quote unquote, benefit from the special education program. That's specifically cited in IDEA. Now, to clarify the benefit from piece, IDEA specifically says that although a student may benefit from speech as a related service, the child will not be eligible to receive that service if they can perform academically without it, or if the service or support does not specifically require the unique skills and expertise of a speech-language pathologist. Another quick clarification is that speech as a related service is not considered, quote unquote, automatically implied or required based on any category of disability. All decisions must be made by the team and based on individual student data. A few things that teams may want to discuss when considering whether or not to add speech as a related service are: one, is the unique skill and training and expertise of an SLP necessary, as opposed to other school-based personnel, in order for the student to advance appropriately towards attaining their IEP goals, to be involved in and make progress in the general education curriculum and participate in extracurricular and other non-academic activities, and to be educated and participate with other children with disabilities and non-disabled children. That's one of the first questions to ask. Then, what data supports that need for speech as a related service, utilizing the unique skills and expertise of an SLP? And then finally, to consider least restrictive environment and whether these services require direct, indirect, and/or supplementary services. As another critical clarification, speech is only considered an embedded area of eligibility if the student meets criteria as a student with a developmental delay and one of the qualifying areas is communication. In this situation, speech language impairment is not listed as a secondary disability. Here's a quick decision tree to make it visually easy for teams to consider whether or not speech is a special education or related service. Speech is a special education service if the student meets criteria as a speech language impairment or for communication is as one of the qualifying areas under developmental delay. Speech is considered a related service if they did not meet eligibility criteria for SLI. The student does have another primary disabling condition. The data determines that the unique skills and expertise are necessary for an SLP in order for the student to benefit from the special education program, and the nature and the severity of the disability requires the unique skills and expertise of the SLP. EdPlan also includes a statement of duration, time period, and frequency. So this may be a little confusing, so let me make sure I can help explain it as clear as possible. So first you're going to select direct or indirect. And duration really refers specifically to the number of minutes. How many minutes will the student be seen per visit? Is it 45 minutes per visit, 30 minutes, 25 minutes, 15, even 5 minutes? The time period is how often will these visits occur? Are they visits occurring per day, per week, per month, per quarter, per semester, per year? And what's the frequency with which these visits will occur? Are they occurring twice a week, once a week, 4 days a week? So again, there's not a rule of thumb that all students must receive this duration, time period, or frequency. All of these services are determined by the IEP team based on the needs of the student, based on the data. Now, in a 3-1 model, you'll see below exactly how this might be reflected. And in the third bullet there, you'll see how this might be reflected in a 5-minute therapy model. Now let's think about location of services, starting with that thread of consistency. The selection of the location really needs to match what you put in the special considerations, and it also will need to match what is selected for prior written notice. Now the big question has always been, do we select school environment or special education therapy room, speech therapy room? What do we pick? Well, the thing to consider is specifically where the majority of the overall program is provided. So thinking about the special education therapy room, that could be individual or group. But if the services are in the speech therapy room the majority of the time, then it would be selecting special education therapy room, not school environment. I'll say that again. If services are provided in the speech therapy room the majority of the time, then special education therapy room, that's what should be selected. Now, there may, of course, be times, I hope there's times, where speech therapy sessions actually occur outside of the therapy room. So you might be doing generalization activities, such as going on a treasure hunt and using your speech sounds in the library. But again, if the majority of services are in the therapy room, what you want to do is you'll select special education speech therapy room, but in the description of services, you might provide that additional information about how the services can be provided and about potential activities that would be outside of the speech therapy room to support generalization. Now let's think about telepractice or teletherapy services or virtual services. One of the things that has to first be decided is whether or not the team has provided input as to whether or not virtual services are appropriate for this service, because every student is not appropriate to receive services through telepractice. The other thing that's important is that in order to provide virtual services, speech therapy services, OT or PT through telepractice, licensure laws for South Carolina require a parent's signature stating that they have informed consent for the provision of virtual services. This must also be reflected in the prior written notice. So in the prior written notice, you would state the parent has provided informed consent for the provision of virtual services. Now, going back to how do we determine this? Well, the decision to provide teletherapy or virtual services, again, that's got to be determined by the IEP team based on the data provided and the needs of the student. So we need to make sure that we're allowing families to be part of the discussion about whether or not to participate in virtual services. And families are allowed to decline teletherapy services. Another thing to consider is if teletherapy services are being utilized. Let's say, for example, the SLP is in Kentucky and the computer is set up in whatever room. There may be a paraprofessional that is hired by the district, and that paraprofessional's role is to pick up the student, walk them to the location where the teletherapy is, assist in the therapy session in any way. And if this is happening, if they're using a paraprofessional, the team needs to consider whether or not this is an indirect service or a supplementary service. I'll say that again. If a paraprofessional is being used, the team needs to consider whether or not this is an indirect or supplementary services, and that needs to be added to the service page on the IEP. In terms of whether or not the student is appropriate for teletherapy, we need to consider cognitive, behavioral, and motivational characteristics. What is their level of cognitive function? What's their ability to maintain attention? What is their ability to sit in front of a camera and even minimize extraneous movement and avoid compromising the image resolution? Also, their willingness, or the family caregiver's willingness, to receive or assist with telepractice. We also need to think about the student's physical and sensory characteristics. What is their hearing ability? What is their visual ability to even see the material on the computer monitor? What's their manual dexterity to operate a keyboard or a mouse? And or is a paraprofessional going to support that? Also, what's their physical endurance? So for example, what is their sitting tolerance? Are they appropriately positioned? The IEP team also needs to consider the communication characteristics. What's the student's listening comprehension, their literacy, their speech intelligibility, and or the use of interpreter if that's needed? What's the accesses to resources in the school building? So what is the availability of the technology and support personnel? Or even the appropriate environment for the telepractice, which requires a quiet room with minimal distractions. And we need to consider other things such as the ability and the willingness of the client or the caregiver or facilitator to follow the directions of the teletherapist, to participate in the session, to assist the clinician, and then also to operate and even troubleshoot some of the difficulties that may happen with technology. In terms of selecting the provider is asking the question, who is providing the services? Well, if services are provided by a CCC SLP, a speech-language pathologist who has the Certificate of Clinical Competence either from ASHA or they're licensed as an SLP by South Carolina Licensure Board, or if they're a CF SLP, a Clinical Fellow SLP, which is also referred to as an intern SLP by South Carolina Licensure, which is not the same thing as an intern who has not completed their graduate program. clinical fellows have completed their graduate program of study and they're completing the supervised work experience necessary to qualify for the CCC. So if those services are provided either by CCC or CFSLP, then that is who goes on the record. I'll say that one more time. If it's a CCC SLP and or a CFSLP, their name can go down as the provider of record. However, if the services are provided by an SLP assistant, the SLP is the provider of record, okay? Because the student is actually not on the caseload of the SLP assistant. The student is actually still on the caseload of the CCC SLP. And the CCC SLP is the one ultimately responsible for all of the services outlined in the IEP. The other thing to keep in mind in terms of providers and the types of SLP personnel is that SLP assistants may not write IEPs and they may not attend IEP meetings without the supervising SLP present. That is just one of the specifications in terms of duties and responsibilities under licensure law. For the other duties and responsibilities and limitations of an SLP assistant, it is on the responsibility of the supervising SLP and the district to be familiar with that information as it's outlined on the South Carolina Labor License and Regulation Board website. Here you see a description of the services from EdPlan. And when thinking about describing the special education services, we're describing the specific directions, considerations, or delivery methods for those special education services, which again could be speech language pathology. So this section is really where you're going to add any additional information, and we've sort of touched on this a moment ago. But it's provided for all IEP team members to have clarity about the services that are being provided. And there's some examples below of exactly what you might put in that box. And same goes for description of related service. Again, this is where you're going to describe specific directions, considerations, or delivery methods for related services. So if the IEP team determines that speech as a related service is necessary in order for the student to benefit from the special education program, this is where that would be explained. And then you see some examples down below. Now let's talk about accommodations. Here's a screenshot from EdPlan about what the accommodations page looks like. And let's talk about adding accommodations to a speech-only IEP. First, thread of consistency. Accommodations must address the identified needs that are written in both the PLAF and the impact statement. Thread of consistency. We've got to make sure we're connecting the information. However, before we add an accommodation that has nothing to do with the student's identified speech language impairment, the team needs to determine if there is reason to suspect another area of disability. And as mentioned, this may or may not involve a formal reevaluation. But accommodations are an IEP team decision, and they must be supported with data. The accommodations that you write in the IEP, they have to identify a very specifically identified need. So for example, if extended time is an accommodation going on that IEP, there needs to be a connection to data in the PLAF stating why this accommodation is needed and or continues to be needed. So there should always be a connection between the accommodations and the impact statement, or the impact of the disability, but there's not necessarily an expectation to see a listing of the accommodation in the impact statement. So you don't have to include that in there. You just have to make those connections. Now, who needs to be there when talking about accommodations? Well, persons knowledgeable with the appropriate accommodations for that area of need. Those are who need to be in attendance at the IEP meeting, because those are the ones who can speak knowledgeably about both the data collected that supports the need, as well as the data collected to support the ongoing need. So for example, if there are medical accommodations, really and truly we need the nurse there. If there are sensory processing concerns or accommodations, We need the OT or someone else who is knowledgeable about that to be in attendance. Same thing for physical limitations and considering the PT. If there's mental health, looking to have the guidance counselor or school psychologist. If there's attention-related concerns, again, psychologists or other appropriate knowledgeable personnel, those are who need to be in attendance. Now, if the student has been identified as a multilingual learner, that student will have an IEP and an individualized language acquisition plan, an ILAP. At one point, there was confusion about if the ILAP accommodations should be on the IEP. The answer is no. Why? That is because the IEP addresses needs related to the disability. The ILAP addresses needs related to the student's language acquisition. So there are different documents for different purposes. But that said, a continuous plan for collaboration and progress monitoring should always be in place with respect to both language acquisition and disability goals. And the students should receive both special education and multilingual support services in order to meet all of their needs. Thank you so much for your time, for your interest, for your attention, for your attendance, and for what you do for students and children every single day. If you have questions, please do not hesitate to reach out. This was a lot of content. I hope that you have paused and absorbed, written some things down. And again, if you have questions, please don't hesitate to reach out. Thank you so much. Bye-bye.